Hello, I'm a certified surgical technologist, and I would like to invite you to learn more about the fast-growing profession of surgical technology. During this presentation, I will try to answer your questions about beginning a career in surgical technology. Would you like to become a part of this exciting surgical environment? Would you like to contribute your talents to taking care of others? If so, a career in surgical technology may be right for you.
What is a surgical technologist?
A certified surgical technologist, a CST, is an allied health professional who works as part of the surgical team to ensure that surgical procedures are performed under safe and sterile conditions.
Who are the members of the surgical team and what are their functions?
Surgical team members function in two capacities, non-sterile and sterile. The non-sterile team members are the circulator and the anesthesia provider. In certain situations, other personnel, such as the radiology technologist or pathologist, may also be in the operating room. The circulator is a registered nurse, a licensed practical nurse, or a licensed vocational nurse. Some of the circulator's duties include interviewing the patient before surgery, transporting the patient to the OR, transferring the patient to the OR table, assisting the anesthesia provider, preparing the patient's skin for surgery, connecting various cords and tubings, providing additional items to the sterile field during the procedure, maintaining the patient's operative record, and preparing the operating room for the next patient. The anesthesia provider may be either a physician or a certified registered nurse anesthetist. Some of the anesthesia provider's duties include administering the anesthetic, monitoring the patient's vital signs throughout the procedure, and providing other support during the surgery. The sterile team members are the surgical technologist, the surgeon, and the surgical assistant. The surgical technologist functions in a sterile capacity during the surgical procedure, but also performs many non-sterile duties throughout the course of the workday. The main responsibilities of the surgical technologist are preparing the operating room, assist with positioning the patient, creating and maintaining the sterile field, entering the sterile field and assisting team members as they enter the sterile field, organizing the sterile instruments, equipment, and supplies for use, preparing the patient's skin for surgery, assisting the surgeon in placing sterile drapes on the patient, assessing and anticipating the needs of the patient and the surgeon throughout the procedure, and providing the necessary items in the order they'll be needed, and covering the incision with a protective dressing once the surgery is finished. The surgeon performs the necessary procedure. The surgeon may be a medical doctor, doctor of osteopathy, doctor of pediatric medicine, or a doctor of dental science. The surgical assistant may be a physician or non-physician. The duties of the surgical assistant include making sure the surgeon has a clear view of the surgical site through retraction of tissue, suctioning, and sponging, controlling bleeding in and around the incision, and closing the wound after the procedure is finished. This is called suturing.
What career opportunities will be available to me once I become a certified surgical technologist?
According to the U.S. Department of Labor's Bureau of Labor Statistics, the demand for surgical technologists is expected to grow much faster than the average for all other occupations through the year 2014. Most CSTs are employed in hospital surgery departments, obstetric departments, and outpatient surgery centers. However, there are many other employment options available to you once you gain experience. You may specialize in an area that interests you, such as cardiac, orthopedic, or pediatric surgery. You may be privately employed by a surgeon. You may want to become a traveling surgical technologist. You can become a surgical assistant. You may be employed by a veterinary surgeon or animal care facility. You may be employed as a sales representative for a medical instrument manufacturer. You may work in the material management or central sterile supply department of a hospital. You may take on supervisory responsibilities, such as an OR manager. You may also become a surgical technology instructor.
What salary can I expect to earn once I enter the workforce as a certified surgical technologist?
The salary for a surgical technologist varies throughout the nation. AST has current salary information on its website. You can also supplement your salary by taking call and working extra shifts.
What type of education is required to enter the field of surgical technology?
In order to take the surgical technologist certification exam, you must be a graduate of an accredited surgical technology program. Surgical technology programs range in length from 9 months to 2 years. You may be required to take some classes before being accepted into a program. Once you've started your program, your coursework will include medical terminology, anatomy and physiology, microbiology, and pharmacology. You will also learn about surgical instruments, equipment, supplies, basic patient care concepts, the principles of asepsis and sterile technique, as well as many surgical procedures. Other courses may include robotics, computer science, and biomechanics. Learning occurs in the classroom, in a mock surgery setting, and in an actual operating room, where you will be allowed to participate in real surgeries with supervision by your clinical preceptor. Graduates of surgical technology programs may earn a diploma or an associate degree. The associate degree is the preferred academic degree for surgical technology.
What is accreditation, and how do I know that the surgical technology program I have selected is accredited?
Accreditation is a system for recognizing performance, integrity, and quality in educational institutions and professional programs affiliated with those institutions. Program accreditation is granted by a national organization, such as the Commission on Accreditation of Allied Health Education Programs, which is commonly referred to as CAHEP. CAHEP grants accreditation to surgical technology programs only after the programs have been thoroughly reviewed by another group, the Accreditation Review Committee on Education in Surgical Technology, which is commonly called ARCST. ARCST reviews programs to make sure they meet or exceed high standards of quality in education. ARCST is composed of representatives from the American College of Surgeons and the Association of Surgical Technologists, and it is the only accreditation review group that's officially approved by the American College of Surgeons and AST. Only those programs that meet ARCST's high standards will be granted accreditation by CAHEP. To find out which programs have been accredited by CAHEP, visit ARCST's website. Remember, you will not be allowed to take the National Certification Exam unless you graduate from an accredited program. So before choosing a program, make sure that it's accredited and that its graduates are eligible to take the National Certification Exam administered by the National Board of Surgical Technology and Surgical Assisting, which is commonly referred to as NBST-SA.
What does certification mean, and how do I become certified?
Certification is a process that helps determine, by examination, whether an individual has met a national standard in both theoretical and practical knowledge in a particular field. Upon passing the exam, you are authorized to use the credential Certified Surgical Technologist, which is abbreviated CST. Certification through NBST-SA is strongly recommended by AST and is required by many employers. Increasingly, many states are also recognizing that the CST credential from NBST-SA should be required as a condition of employment.
How long does certification last?
The certification period is 4 years.
How do I maintain my certification as a certified surgical technologist?
Maintaining your CST credential means that you renew your certification every 4 years. As a CST, you have 2 options to do this. You may retake and pass the CST certification exam on or before the expiration date of your certification, or you may provide proof to NBST-SA that you have completed 60 continuing education credits during your 4-year certification period.
What is the Association of Surgical Technologists, and why should I join the organization?
The Association of Surgical Technologists, AST, is the only professional organization in the U.S. for surgical technologists. Since it was formed in 1969, the primary purpose of AST has been to ensure that surgical technologists have the knowledge and skills to administer patient care of the highest quality. This has been accomplished through accreditation, certification, and education. AST offers educational publications, products, and events of interest to surgical technology students, instructors, and practicing surgical technologists.
What are the benefits of becoming a member of the Association of Surgical Technologists?
Surgical technology students may join AST at a special reduced rate and at the same time join AST's Student Association at no additional charge. Student members of AST receive a substantial discount on the National CST Certification Exam and receive a special student newsletter at no additional charge. All AST members receive a discount on the registration fee for the National Conference, workshops, and specialty forums. Members can earn discounted continuing education credits, and AST processes and maintains those continuing education credits for members at no charge. All members also receive AST's monthly journal and are eligible to participate at the local level in their state assemblies. At state assembly events, you can network with colleagues, identify potential employers, and engage in legislative activities.
Where does the future of surgical technology lie?
Rapid advances in medical technology will bring dramatic changes to the field of surgical technology. The operating room of today incorporates computers, electronics, and robotics to carry out routine patient care. Throughout your career, AST will help you be prepared to meet these advanced challenges. If you want to make a difference in someone else's life, then surgical technology is the career for you.
Where can I get more information?
Please visit AST's website or call AST's Member Services Department.